Hey guys, we're going to go over cranial nerves today. This is related to AP2 material. It's also going to be a great review for anybody pursuing nursing, trying to study for the TEAS test for science. This might be very helpful as well, or just anybody needing to study cranial nerves for a program, in a health-related field. So we're going to go over them, just kind of hit the main points. I always tell my students, the basics of cranial nerves is knowing the name, the number, of course, and then the function. So let's knock it out real fast. We're going to start with cranial nerve 1. This is the olfactory nerve. Okay, and you'll notice I've already written down that it is a sensory nerve. And what is going to be the function of the olfactory nerve? It's going to be smell. And again, a lot of times if you're taking an AP2 course, you're not going to have to know the level of generally of the clinical level of how to test cranial nerves, but it is kind of nice to know that, hey, how would I test olfactory nerve? Well, of course, it's a sensory nerve. I'm going to test smell by just basically putting a distinct smell that, they're not looking, distinct smell of some sort under their nose. A good example would be cinnamon, because everybody recognizes it, but it's not harsh. So it's literally how we're going to test it. So jump on to cranial nerve 2, which is optic nerve. This is also sensory, and this is going to be vision. Okay, optic nerve is going to give us basically ability to see. So how do we test that? You would actually test that with a Snellen eye chart. So they're looking at an eye chart, and basically, depending on what they see, obviously that's testing vision. It's not eye movement. We'll get to that in a little bit. That's the optic nerve, and again, it's purely sensory. Then we're going to go on to cranial nerve 3. We're going to also talk about cranial nerve 4, and we're going to kind of jump down here and also talk about cranial nerve 6. Kind of put these three together. This is spell this here, oculomotor. This is trochlear, and this is abducens. My spelling is not the best, I apologize. But here is oculomotor, trochlear, and abducens, 3, 4, and 6. Why do we put these together? These are the three that control motor to eye movements. So these three collectively allow your eye to move in all ranges. How do we test that? Right, if I had a patient, right, I just tell them to follow my pen with only their eyes, and I do like an H pattern that I'm watching to see if they can track all directions with their eyes. And if they can, then we know collectively 3, 4, and 6, they're good, okay? So if you want to know specifics, oculomotor is going to basically look more or less up. It's going to let you look up. Trochlear is going to more or less make you or help you to look down, and then also inward. Abducens kind of tells you what it does. It abducts. It's abductor for the eye. So kind of gives you an idea of what those eye movements are going to do. But we skipped one, of course. So that was 3, 4, and 6. Now cranial nerve 5, just kind of throw in the middle here, is trigeminal. And trigeminal nerve is our first mixed. Okay, what does trigeminal nerve do? It's going to obviously have a sensory, so we can just kind of do it this way. It's both sensory and motor, so it's sensory to the eye, and you can read this, sensory to the eye and face, right? So I can take a little wisp of cotton, put it in the corner of the eye. If they blink, that tests sensation. Also, I can check sensation on the face using a pinwheel or even like a toothpick or something. And then motor is going to be muscles of chewing. Okay, trigeminal is muscles of chewing. So that is our two components there for a mixed nerve, sensory and motor components. Then we've done 6 already, so we can go ahead and jump down to 7. That's going to be facial. Okay, this is another mixed. So we'll have a sensory and a motor portion again, sensory, is actually going to be taste to anterior 2/3 of the tongue. Now we're getting a little long here, but that's the anterior 2/3 of the tongue. Taste is a sensory, special sense, right? Motor is going to be muscles of facial expression. So the muscles of facial expression. So if I wanted to test this, go back to trigeminal for a minute. It's easy to test trigeminal really fast. I just get them to clench their jaws, feel the masseter, see, make sure it clenches. That tests the muscles of chewing. Come down here to facial. How would I test muscles of facial expression? I give them a smile. Get them to frown, raise the eyebrows. Obviously, to test taste, you can still go back and use cinnamon again. Put some on the tongue. Got to put it on the front of the tongue and see if they can taste the cinnamon. I mean, it's not the easiest test, but that's what would be done. Okay. So that's facial. Then we go to our last sensory nerve, which is cranial nerve 8, which is vestibulocochlear. Vestibulocochlear nerve. This really tells you what it is right here. It is sensory only, so I'll just pull through a sensory out here. It is equilibrium. That's our vestibular portion. So that's going to test our balance. How do we test it? We test somebody's balance, right? Get them to do a Romberg's test. If they're good with that, it's generally equilibrium's fine. And this is the vestibular portion or cochlear portion, of course, is hearing. And again, there's some basic hearing tests like Weber and Renee, or more advanced tests that you can do to test hearing. But that, again, tells you basically what cranial nerve 8 does. Cranial nerve 8 is a sensory nerve, but it's 2 parts. Again, it's basically one nerve bundle with 2 sets of fibers in it. One set of fibers controlling the cochlea, and then the other set controlling the vestibular apparatus. Okay. Then we run down to cranial nerve 9. This is glossopharyngeal. Kind of a big name there. This one's going to be mixed. Glossopharyngeal, therefore, is going to do a sensory and motor function. Sensory function for glossopharyngeal is going to be taste again to the posterior 1/3 of the tongue. Taste to the posterior 1/3 of the tongue. Motor is going to deal with the muscles of swallowing, and I can smell swallowing right here. Swallowing, and also the gag reflex. Okay, it's going to deal with the gag reflex. We can test the motor muscles by doing a gag reflex, eliciting a gag reflex, and of course testing taste on the back of the tongue. That's going to be glossopharyngeal. Cranial nerve 10 is vagus, which has the widest distribution. It is mixed. All right, mixed over here because we're running out of space. It's going to be sensory and motor. Sensory is going to be taste in walls of the mouth. A lot of people don't realize there's taste buds in the walls of your mouth. So taste in the walls of the mouth is vagus. So that gives us 3, if you've been counting, 3 cranial nerves that control taste. We've got cranial nerve 7, which is facial, cranial nerve 9, glossopharyngeal, cranial nerve 10, vagus. 3 of those collectively control all taste. 2 of them on the tongue, which would be facial and glossopharyngeal. Okay, so that's walls, taste in the walls of the mouth. Motor is gonna, for the vagus, is gonna be swallowing muscles again. Some swallowing muscles involved. There's like 22 plus muscles involved in swallowing. So some muscles are vagus muscles, some are glossopharyngeal. Some of the muscles for swallowing are still vagus controlled. And then it's also going to be basically almost, I'll just put almost all viscera. Again, viscera meaning organs. It's going to control almost all viscera, and that is a parasympathetic control only for almost all organs of the body. It's going to basically, for most organs, it's parasympathetic, which means it's going to slow the organ down, with the exception of digestion and urination and things like that. So that's the vagus. Again, because it's going to almost all viscera, right? It's a motor function. It's going to be a very wide distribution. Okay, so it's literally coming from the medulla area of the brainstem, and it's all the way down to, even lower abdominal organs. Okay, so cranial nerve 11, cranial nerve 12. So the last set. Cranial nerve 11 is accessory. That is its name. It is only, I'm going to try to squeeze them all in here. It is motor only. And so is 12. Accessory is only controlling two muscles, and I'm going to just abbreviate for space. SCM, which is sternocleidomastoid, and trapezius. So it is the motor supply for sternocleidomastoid and trapezius, which means, how do I test it? Sternocleidomastoid rotates the neck, actually rotates contralaterally. So I can get them to rotate the neck. I can get them to shrug the shoulders for upper trapezius. If they can do that, then we know accessory nerve works. It's motor to those two muscles and those two muscles only. Lastly, this is hypoglossal nerve. Last nerve, which is number 12, students mix this one up all the time. It is motor only, which means what does it control? It controls the muscles of your tongue. So it's going to control tongue movement. So what do? I get them to stick out their tongue. If they can stick out their tongue right down the center, there's no weird deviation, can move the tongue side to side, hypoglossal nerve works. What students mix up on this one is they think hypoglossal, they think sensory, they think taste. Well, this is not taste. We've already covered taste. It's 7, 9, and 10, okay? So hypoglossal is just muscles of the tongue. So it's a quick rundown on cranial nerves. Little trick too, if you want to think about, okay, which ones were sensory? We had 1, 2, and 8. So I just remember 1, 2, 8, that's sensory. What about mixed? Because mixed is actually the next, least amount. If you think about it, it was 5, 7, 9, 10. That's our mixed. 5, 7, 9, 10. Okay? Which means everything left over is purely motor. Okay? In the end, if you want to do well in anatomy, this is a big section for a lot of courses. Just remember name, number, and again, function. Thank you all.